So good afternoon, everyone. Today, I would like to present my paper on COVID-19 vaccine risk communications management in Indonesia, a case study in Surabaya City and East Java Province. So I'm here representing all the authors of these papers for the conference. So first of all, actually, the research is based on some informations and some phenomenon that we know since March 11, 2020, the WHO has declared that COVID-19 as a pandemic, and then the Indonesian governments 2 days after that announcement, established the COVID-19 task force for the accelerations of handling in the countries. And then a year after that, in January 13, 2021, the Indonesian government has introduced the vaccinations programs for the first time for the Indonesian citizens. And it was started by the formal or official launchings of the vaccinations program when the presidents of Indonesians, Joko Widodo, received as the first persons who get vaccinated at that time. And then after that, during years, the program is actually targeted, will finalize in December 2021, when the Indonesian citizens, almost all the Indonesian citizens, have received at least the first jab of the vaccinations. We have several types of vaccinations that has been used in Indonesia. So there are Sinovacs or Sinopharms, and then the second one is AstraZeneca, and then the third one is actually the Indonesians' own vaccines, but has been rumored, but it's not yet being decided by the Indonesian governments, what we call the Vaksin Nusantara. And then there will also be planned another vaccines from some university, including the Airlangga University. Actually, according to the survey from the secondary resource that we received, we got it from the Tirto ID. It is the news portals online Indonesia, which take the research to the Indonesian populations. So the samples were 1,200 people, and they were asked about the willingness to be vaccinated. And this survey taken place where the vaccination program was about to release. And then this is the report, the reasons that the Tirto gained from the peoples. That's actually 43% of the populations refused to be vaccinated. Actually, this research is quite close to the result from the Indonesian's university, other Indonesian university research, which was not Indonesian university, it's actually the Indonesian government research supported by the WHO research, saying that there are still more than 30% of the populations in Indonesia rejected to be vaccinated. So based on that research, we see that this is one of the significant factors influencing the understanding of the public toward the risk concepts in cultural values and social traditional beliefs that forms public perception. This has become the key point for some Asians risk communications and risk researchers. So we have the similar problems in Asia because of the belief, the cultural belief, the religious concerns. That's why not all the populations in our country, in Indonesia, and in some part of Asians are still hesitate to take the vaccine into their bodies. So this present study will analyze how risk has been conceptualized by the administrative regional governments, and then we take samples. We take a case study in Surabaya where we live. I mean, like Airlangga University is placed in Surabaya, and the East Java province, where Surabaya is actually the capital city of East Java province. And so we look at how risk, particularly COVID-19 vaccine, is being assessed, regulated, control in these two administrations areas. So this study is conducted with two approaches. The first approach is we did the assessment to government's documents on the vaccine, on the risk management on the vaccinations program. But unfortunately, since we cannot receive the formal document, the official document, because there is no such official document on risk communications managements issued by both the East Java governments and the Surabaya city governments. So we relied more our analysis on the visuals, presentations that has been circulated and distributed by both the East Java provincial governments and the Surabaya city governments. And the second approach that we did is the study conducted interviews with the official representative from the Department of Informations and Communications of the East Java, and also with the health staffs in the Department of Health in both city, in Surabaya and in East Java city. So we see that the COVID-19 vaccination programs in Indonesia, as I mentioned before, the implementations of the vaccination program was introduced early in January 2001 in these years, and it was President Joko Widodo who received the vaccination programs. And then after that, the various opinions about the pros and cons related to these programs were presented in the midst of community when the vaccination program was started. And then so the controversial issue continued to be the public discourse until now. Even before them, the governments released the new restricted programs, restricted mobilizations programs from the 2nd of July until the 23rd of July recently. And then so because of the increased numbers of those considered as positive in COVID-19 and the numbers of the death toll rise during these months in June and July. And then so the governments then try to do the mass vaccinations programs, but it's not to all city and to all provinces in Indonesia. That's why we look at how the case has been handling the vaccination program, the mass vaccination programs in Surabaya city and in East Java provincial governments. So it's actually in the central governments, the central government through the Ministry of Information and Communications, there has the applications programs, what the applications program called as Peduli Lindungi. So this apps program can be used by the citizens in order to track the pandemic's news, and also in order to track the informations about the vaccinations programs. If we look at the examples in East Java province, so these are all the posters that has been circulated into our social media through the Facebook, through the Instagrams, through the Twitters, and through the WhatsApp groups, officially introduced by the government, the East Java governments, and also by the by the mass media in Indonesia. So the government tried to use that. Also in Surabaya city, there is also the informations about the vaccination, the mass vaccination programs that has been introduced to the society, and then how to get the vaccinations, how to get jab, and then where they can assess that, and then what procedures should be done, and so forth. But again, as Surabaya city consists of multicultural or multi-ethnic populations. So we know that some peoples are willing to do that, but some peoples continue to reject the vaccinations programs. So what we can learn from this vaccination risk communications management that has been practiced by the East Java governments and Surabaya city governments is that we can only look at or follow through the website, the official website that has been provided by both the East Java government's province authority and from the city of Surabaya governments. But again, because the degree of digital literacy of our peoples in East Java and also in Surabaya, so then this website is actually receive small or few followers, yeah, or people who look at into this this website. So the information is actually very low, been accepted by the ordinary people in East Java provinces and in Surabaya city. So we see that the vaccination risk management in both area that we are looking at is actually many people say that they do not know about this, they do not know about whether there is the vaccination program or not. So what we try to criticize here that both the East Java governments and the Surabaya city government should establish the risk communications management protocols or scenario. So when there is the pandemic outbreak, because we just received the second wave outbreaks, I don't know, maybe we will have the third or the fourth. So by now, if we look at this poster, so the response both of East Java governments and Surabaya city government is actually instant, yeah, or coincidentally. So they do not have the plan, but they just like direct response when the numbers of people who get positive in COVID-19 become high, and then so they make this kind of visual informations. So if we look at this, these are examples of some of the posters that the digital posters that the East Java governments, the Indonesian governments, and then the city Surabaya governments has produced and distributed to the populations. So again, in fact, that the public has not widely accessed this website, yeah, like the website that we mentioned earlier. So not all the Indonesian citizens actually have a qualified digital literacy. So most of them spread in various small towns and rural areas with no access to the internet. Even people in urban area, they do not have an access to internet, but they only have an access to the social media. So in urban society, yes, people have an Instagram account, Facebook account, or a WhatsApp account, but they do not access the internet. So they only access through their social networks applications only. So departing from this condition, the Indonesian government should disseminate information related to the vaccination and the EFI through standard printed documents published in various accessible places such as vaccination sites or leaflets. So the people will read that, and the people will distribute it, all the pamphlets, maybe the brochures and so forth, to other families who do not have the digital devices as well. And so this effort will prevent the public's misunderstanding about the vaccinations and events that follow it. So even though it has, even though it has been running for more than a year, so risk communications management in Indonesia is still struggling, to deal with the pandemic that is still increasing. So we do not have that kind of risk communications management protocols that been clearly stated or transparently circulated in the publics. So since the beginning, government not taken a firm stance in dealing with this pandemic for various reasons, primarily the economic factors. And the government has also frequently changed its policy, which in the end, all prevention efforts always feel too late. Repeated denials by some officials undermine public confidence. And instead of refusing the handling of the pandemics to medical authorities, the president has repeatedly formed task force chaired with officials who do not match their expertise. So even the epidemic rages, the central government quickly blames the failures on the regions. So inappropriate data, synchronizations, lack of socialization related to the importance of vaccination occur in Indonesia. And then if we look at the procedures for using the Peduli Lindungi applications for tracing, tracking, and vaccine invitations that were not conveyed thoroughly, then the coordination between the government institution is irregular, since some leaders see the pandemic from a political perspective and increasingly undermine public trust. And then institutional reforms is actually essential to get out of the COVID-19 crisis and anticipate a pandemic in the futures. So this is our suggestion based on the data that we receive. Institutions dealing with outbreaks must be led and consist of qualified public health expert, infectious disease expert, and public policy merchant-minded bureaucrats who prefer to calculate the economic pros and cons. At the same time, the government needs to rebuild public trust. The way is by stop being denials while being honest with the public, including when making a mistake. With that trust, the community can be invited to work together to fight the pandemic. So in conclusions, the exchange of real-time information, advice, and opinions between experts and people facing threat to their health, economic, or social well-being, as has been defined by WHO as the definition of risk communications, has to be implemented in Indonesia. And then based on that information that we receive from the journals, that there are two models of risk communications. The first, what they call realist approach, which view risk as objective and independent from the social context. And the second one is the social constructionist approach, which view risk as something linked to the socio-cultural context. So in this study, it can be seen that risk communications related to the COVID-19 vaccine in East Java and Surabaya is using the second approach. That is the social construction, which view risk as something linked to the social cultural context. And it is proven that the implementations of the vaccination program by the provincial and city government is done through an approach to the authority of the village and local residency, which is closer to the people than the central governments. So religious and traditional approaches turn out to be significant in encouraging people to be willing to be vaccinated, although not so many are eager to do so. So these are all that our presentations. So thank you very much for your attentions. And after this, we can have the questions and answer. Thank you.